North America is in the middle of the deadliest health crisis of our generation.
Our drug supply is toxic,
and it's killing people
at unprecedented levels.
In Canada alone, we have lost over 10,000 people in 3 years.
That is why harm reduction services are so vital right now.
We need to be amping up our response to deal with the crisis and listening to the voices of frontline workers and people who use drugs. In downtown Toronto, the crisis is especially apparent at the intersection of Dundas and Sherbourne.
This intersection has the second highest number of 911 overdose calls in the city and is home to many of the city's most vulnerable residents. Street Health has been offering health and social services in the Dundas and Sherbourne neighborhood for over 30 years. Based on the obvious need of the community, we opened an overdose prevention site in June 2018. An OPS is a low-barrier supervised injection model that provides our clients with life-saving services. Since then, we have hosted over 2,000 injections and reversed about 40 overdoses. But more than that, we've built relationships.
We have made integral connections with people who might not otherwise be accessing services elsewhere.
We're thought of, we're cared about. We're not just, like I said, another statistic. We're actually human. We're not judged. We're looked at like we're actually human people. We're human beings.
And we continue to connect people to other services that Street Health offers, like healthcare and counseling.
Ones like this have a good, small amount of staff, which I find much better because you get to know them more personally and you're more comfortable sharing those personal things with them, so they can more easily refer you to like rehab counselors and groups and meetings, stuff like that.
60% of our clients are women, which is a huge success in and of itself, because we know that women are less likely to access harm reduction and safe injection sites. Shortly after opening the Street Health OPS, the provincial government announced a review of Ontario's supervised injection services. At the end of the review, the provincial government unveiled a new consumption and treatment services model. This new model proposes increased barriers for agencies and people who need to use injection services, and required all existing sites to reapply to stay open.
So we applied.
And we waited.
On March 29th, the Ontario Ministry of Health announced they were immediately cutting funding to our overdose prevention site. We were to close our doors and end our services that day.
In the middle of the worst public health crisis of our generation, the government was telling us to end the life-saving services that we had been offering to our clients with no notice. Thankfully, we received a temporary exemption from the federal government to keep operating our site, but we are still without funding.
While we believe it is the government's job to fund the evidence-based services that will end this crisis, we will raise funds and keep our doors open any way that we can.
Sadly, we are turning to the public to ask for help to continue to support our services.
This is not just about budget cuts.
It is about continued inaction
in the face of a public health crisis. It is about the lives of people who use drugs and their basic human rights. Because this work is vital.
And overdose prevention sites save lives.
Where do you think you would be without an OPS?
Oh, 100%. I'd be dead.
I'm alive because of this site, stay up.
Without this place, I think I wouldn't be here. I think I'd probably be another statistic in the staircase.